Hello, grade 10 students. Today, we are going to discuss the first module in your Health 10, which is the components of consumer health. So, are you ready? First, let us know what is consumer health. Consumer health is not just about buying a certain products or services. It is also about making decisions whether to buy and use that health products and services, and of course, having a clear and deeper understanding to make wise choices. Therefore, to ensure consumer health, criteria and guidelines in selecting health products and services must be considered. Various forms of providers and plans must also be known to a customer. Consumer health has three components. We have health information, health products, and health services. So, isa-isahin natin ang tatlong components na ito. Una, health information. Kapag sinabi nating health information, these are concepts, steps, or advice that various sources give to aid the health status of an individual. In fact, napakalaking role ang ginagampanan ng health information sa buhay nating mga consumers. Binibigyan tayo ng mga kaalaman na maaari nating gamitin to make informed decisions about our health. More than that, health information is an idea that we hear from people around us. Those we read from books or other printed materials or from the media that influence our health. We have here an example of health information. So makikita nyo dyan ang nutrition facts ng produktong ito. Ilang calories, cholesterol ang pwede nating makuha, kung ano ang ingredients nito. At ito ay nakadikit na mismo sa packaging ng produktong ito. Next is, makikita nyo dyan kung papaano gagamitin ang produktong ito. May tips na rin. And the other one is the direction for use, the ingredients, and the advice. So sabi niya, keep out of reach and sight of children. Store in cool temperature and dry place. Keep the product away from direct sunlight and for external use only. So, ilan lamang ito sa paalala, okay, tungkol sa paggamit sa produkto na yon. So, those are examples of health information na nakalagay mismo sa packaging ng health products na ating binibili. Now, what are the sources of health information? First, medical and health professionals. Okay, pwede tayong makakuha sa mga family and school doctors, dentists, nurses, and health science educators. Next is we can also get information from government agencies like the Department of Health, Food and Drug Administration, Bureau of Food and Drugs, and the Department of Trade and Industry. Another one is sa mga websites. Pero, dapat piliin nyo and they should be ending in gov.ph, edu.ph, and org.ph, mga ganon. Kasi, legit yung mga yon. Legit sources of health information. And then, we also have the local health officials. An example of this is the barangay health workers. And then, last is educational institutions like schools. There are also unreliable sources of health informations na dapat nating iwasan. The first one there is outdated customs, practices, and superstitions without scientific basis. Example of this is yung paniniwala natin kapag may sore eyes, ay ipahid mo daw yung ihi mo sa tuwing ikaw ay gigising sa umaga. With this daw ay gagaling ang iyong sore eyes. Another is, kapag masakit ang ulo mo, kumuha ka daw ng talong, i-slice mo daw ito at ilagay sa iyong sentido. Which is, alam naman nating walang scientific basis. Pero, pinaniniwalaan ng mga lolo at lola natin na eventually ay naipasa naman sa atin. So, unreliable source po yun. And then, the information based on ignorance and prejudice, or ito yung mga incomplete data. And then, commercialized health information. Lalong-lalo na kapag ito yung mga commercial na ipinapalabas sa television. Okay. Ano tayo dito? Warning lang. Huwag magpapaniwala sa mga to. Okay? Siyempre, commercialized ang mga to. And then the last one is the quack or pseudo healers. Or ito yung tinatawag nating unlicensed practitioners or yung mga albularyo. Dumako naman tayo sa health products. Ano ba ang mga health products na sinasabi natin dito? These are food, drugs, cosmetics, devices, and vaccines that we use, okay, to improve our health. Okay? This may be purchased from various places like supermarkets, pharmacies, and hospitals. Halimbawa nito, these are eyeglasses, appliances, medicines, grooming aids, your toothpaste, yung mga pagkain na kinakain natin. And then, how about health services? These are usually offered by healthcare providers. Okay. Healthcare providers are trained professionals who provides people with healthcare. Okay. So, ito yung mga health providers na nagbibigay ng serbisyo sa atin para maalagaan or ma-improve yung ating kalusugan. There are 3 types po. First, we have health professionals, healthcare facilities, and health insurance. Ang una rito, health professionals. These are individuals who are licensed to practice medicine and other allied health programs and work in the medical professions. These are our doctors, nurses, our nutritionists, our dentists, mga yun po, halimbawa ng health professionals. We also have healthcare facilities. Ano naman yung ang healthcare facilities na to? These are places or institutions that offer healthcare services. Examples, we have hospitals, walk-in surgery center, health center, and extended healthcare facilities. So ito, yung mga pinupuntahan natin kung meron tayong nararamdaman, kung gusto nating magpa-check up, dito tayo nagpapagamot. So healthcare facilities po ang tawag sa kanila. And then we have health insurance. Ano nga ba yung health insurance? It is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. An example of this is our PhilHealth. Okay. PhilHealth is a government-owned and controlled corporation or GOCC created through Republic Act 7875, also known as the National Health Insurance or NHI Act of 1995. PhilHealth aims to provide health insurance coverage for all Filipinos and ensure affordable, acceptable, available, and accessible healthcare services for all citizens of the Philippines. PhilHealth ensures that every Filipino is a member by covering them under different membership programs which are categorized according to various sectors of our society. So itong PhilHealth na to is binabayaran. It's either binabayaran ng employer or for us sa government, mga government employees. Okay, kami po, nagbabayad kami sa PhilHealth, binabawasan yung sahod namin at may napupunta sa PhilHealth. Para saan to? Itong binabayaran namin monthly ay ito yung parang contribution mo so that by that time na nangangailangan ka ng assistance, financial assistance, ikaw ay nagkasakit, ikaw ay na-hospital, si PhilHealth ngayon ang magbabayad ng iyong mga gastusin. Okay, kung ikaw naman ay may sariling negosyo, wala kang boss, wala kang employer, pwede kang magbayad mismo sa PhilHealth so that may magagamit ka later on kapag ikaw ay na-hospital. Ito ang mga yon: employed or members in the formal economy, employed or members in the informal economy, indigent members, sponsored members, lifetime members, and senior citizens. Once enrolled under PhilHealth, a member should declare his or her legal dependents so they can also be extended of the same healthcare protection and benefits as that of the principal member. So, ibig sabihin, kunwari ako yung naging member sa PhilHealth, meron akong dependent. Okay? Legal dependent. So, merong criteria yung mga yan kung papaano ka maglalagay ng or makonsider bilang dependent mo yung mga, kunwari, member ng other members of your family. Okay? We have here an example of PhilHealth card. Okay, so meron siyang PhilHealth number, yung pangalan, and then yung validity of the card. So my dear grade 10 students, those are the components of consumer health. Let us not forget that all of us are consumers. We acquire health information, purchase health products, and avail of health services to appraise, improve, and maintain our health. Health information is an idea that we hear from people around us. We read from books and other printed materials or from the media that influence our health. Health products, on the other hand, are items that we consume to improve our well-being, such as medicine, food, clothes, furniture, electronics, and the likes. To ensure consumer health, criteria and guidelines in selecting health products and services must be considered. Various forms of providers and plans must also be known to a consumer. Health services are programs we avail from various providers such as physicians, nurses, therapists, health workers, hospitals, clinics, and the government. Some examples of these health services are insurance, treatment and cure, and complementary and alternative medicine. In this light, we must all be educated. That's all. Thank you for watching. Have a good day. Once again, this is your teacher, Michelle, for your MAPEH lessons.